My name is Dr. Sabi. I'm a pediatrician and a pediatric cardiologist. Studied in Berlin, work in Berlin for many years now, work in my own private practice. So today we want to talk about the coronavirus and the vaccination. Actually, I'm personally vaccinated too. I was vaccinated since January, right at the beginning, and I had no problems with the vaccine. So I think it's very important to do the vaccine, and the main goal of the vaccine is to avoid many people from getting the corona disease because it is not easy to treat. And we know that, for example, in Berlin, the number of beds, the intensive units are very limited, and the number of machines used for the respiration of patients who are severely ill are also very limited. We have to vaccinate as many people as possible because to have a general immunity in the population, at least 80% of the population has to be vaccinated. The studies that we have for now indicate that the vaccination is very effective. So the probability that somebody can be sick after having the vaccine is very, very limited. The vector vaccines and the messenger RNA vaccines. The messenger RNA vaccines are BioNTech and Moderna. Meanwhile, the vector vaccines are AstraZeneca and Johnson & Johnson. So in a nutshell, all these vaccines offer a very good protection against the coronavirus. The first issue to note is how the messenger RNA vaccine functions. When the vaccine is introduced into the body produces some proteins that are similar to proteins that are available on the surface of the viruses, the so-called spike proteins. So these proteins are similar to the viral proteins. As such, the body generates antibodies that fight against these spike proteins. In this case, whenever a person is infected by the virus, these antibodies can fight the virus so that the person has no illness. In some cases, very mild from the illness, but in most cases, the patients or the persons concerned are not sick of the coronavirus. And then the other kind of vaccination, for example, AstraZeneca works on the principle of the vector vaccine. In this case, a kind of virus that is not dangerous is introduced into the body, and before this introduction, part of this virus is infected with the coronavirus, so that the virus genome is a little bit altered. As such, when the virus is introduced into the body like the vaccine, the body also produces spike proteins that are similar to those on the coronavirus, that also induces the immune system to produce antibodies. These antibodies are then used by the body to fight against the disease whenever we have contact with the coronavirus. So these two kinds of vaccinations are very effective, and to date there has been a lot of success. So that's meaning that most people who have been vaccinated hardly become ill or just have mild symptoms. One other important thing to note is that some people think, or has been widely said, that the vaccine can integrate into the genome of the human or to the genetic code of the human being and cause some problems. Till date, there has been no proof of that. So this messenger RNA is not the DNA, it's just a messenger RNA which transfers information in the body and cannot integrate in the normal genetic code in the DNA. One question which is also not very clear is, after the vaccine, do we automatically have antibodies? The answer is no. The body needs about 15 days, approximately 2 weeks, to build these antibodies. So we have the full protection about 14 days after the second vaccine. It's important to note that for some of our brothers who are Muslims, the vaccines that are available on the market now, according to information from the producers, there is no products from the pig in these vaccines. So people who don't eat pigs, like Muslim, can also have the vaccine, and there's no risk of having some substances from the pig in this vaccine. I think we should not also forget about the risk that can be associated to the vaccination. Just like any other vaccine, sometimes you might have some light pain in the area of vaccination, like muscle pain. Sometimes it can lead to swelling or redness. All these things are temporary and they always disappear within a few days. Some patients even complain of light headache and painful joints. These are symptoms that disappear within a few days, and these symptoms can also occur with other vaccines like tetanus vaccine or the cholera vaccine or yellow fever vaccine. So all vaccines can always cause these side effects. So these side effects are not only typical of the coronavirus vaccine. One also important thing to talk about is the fertility. There are some theories that say that after vaccination, women can be unsterile or they cannot produce children anymore. Up to date, there has been no proof that this theory is true. So there's no fear of being sterile after the vaccine, but because there has been no proof that this vaccine can cause sterility in men or in women.